Between 18 and 28% of people in the United States suffer from gastroesophageal reflux disease, also known as GERD, according to the National Institutes of Health. People who suffer frequent heartburn may be experiencing GERD. With the readily available access to over-the-counter antacid medications, many people could be experiencing this condition unknowingly. Hello everyone, I'm Daniela Contreras. I'm here with Michelle Brown, a nurse practitioner at Enloe Health, to talk about acid reflux and GERD. Thank you so much for being here today, Michelle.
Thanks so much for having me, Daniela.
So let's start with what is the difference between heartburn, acid reflux, and GERD?
That's a really good question. I think heartburn, most people are a little bit familiar with. They've heard about having like an uncomfortable feeling in your chest, but acid reflux can be when stuff that's acidic comes up in your esophagus and you don't have any symptoms. You don't feel anything. You don't even know it's there. GERD is the disease that you could have either one of those symptoms. You could have heartburn, that feeling of that burning or discomfort, or you could have acid going silently up in your chest and you don't even know it.
Oh wow, so interesting. And let's go a little bit more deep into GERD. Like what is happening in our bodies? What is GERD?
So GERD is gastroesophageal reflux disease. So that is when stuff in your stomach goes up into your esophagus. So sometimes that stuff is acidic and sometimes it's not, but it depends on a variety of things on whether or not you're going to have stuff from your stomach end up in your esophagus where it shouldn't be.
Does it make it all the way to the mouth?
It does sometimes.
Oh wow.
Yeah. So people who wake up with symptoms like hoarse voice or a sour taste in their throat, or wake up with like a cough and they think maybe they have asthma, that can be signs that acid has gone all the way up the back of the throat, even towards the mouth, especially when you're sleeping.
Wow, so interesting. So speaking of symptoms, what are some of the most common symptoms of GERD?
I think most people identify with having that acid feeling behind their chest, like a burning kind of up in their chest. But some people don't notice that some of the other symptoms of GERD can include like a hoarse voice, it can include that cough, it can include chest pain. So it can be a variety of symptoms.
Oh wow, very interesting. Is food the main cause of GERD?
The answer to that is yes and no. For some people, certain foods really cause GERD and symptoms, and if they can limit or eliminate those foods, they do so much better. But for other people, it doesn't seem to matter what they eat or what they do, they're going to have problems with GERD. And there's a reason for that. Some people, the muscle between their stomach and their esophagus is weak or it doesn't work well. So if that muscle doesn't work well, no matter what you eat, it's going to come back up into your esophagus because there's nothing keeping it in place. For other people, though, they might have other issues like too much pressure in their belly and that pressure kind of pushes things up. Or for other people, they eat certain foods and they have so much acid, they produce extra acid, and then they end up with acid up in their esophagus. So there's a variety of reasons.
Oh wow, so interesting. And what could be some of the consequences if people don't treat this?
Well, I think the most important thing is people kind of assume if they have heartburn, they say, it's just GERD. I'll ignore it. I'll treat it with over-the-counter stuff. But the problem is, unfortunately, chest pain or chest burning can be symptoms of other things that are super important. Obviously, your heart's there, so we would want to check out the heart's okay. But other things include what we call Barrett's esophagus, where the esophagus is getting eroded away, or even cancer. So it's really important you not assume that what you're feeling is GERD. You find out first.
So speaking of finding out, how is this condition usually diagnosed and treated?
Usually our first step is to have you go into your primary care physician's office. And if your symptoms are very straightforward, they can attempt just a basic treatment. And if that works and things are successful, you can move forward. However, if your symptoms are unusual, persistent, severe, don't respond to treatment, at that point it'd be great if we referred you to Digestive Health and had them put a camera down an endoscopy and we looked at the actual tissues and took biopsies if we needed to. The other options include doing a pressure test inside the esophagus or even doing a pH monitor to see what's going on to actually solve the problems that are causing the GERD.
Oh wow. And you mentioned over-the-counter medications a little bit ago. Is it okay to be taking them, especially like regularly?
Over-the-counter the medications are great. The problem is they're only great on occasion. If you're taking them regularly or consistently, if you're instead of one bottle, maybe you're on your second or third bottle, at that point you should really be checking in with a physician and just confirming that that's the problem. And the other thing is you want to make sure that not only do you confirm that's the problem, but get it treated appropriately so that you don't get those further problems of acid in the esophagus causing you issues that you could prevent.
Oh, perfect. And what are some of the measures that people can take to prevent this condition in the first place?
Some really important prevention includes one, trying to eliminate nicotine and tobacco. Not only do they have other health side effects, but they also you have increased problems with acid and eroding of the lining in your stomach and esophagus with those products. You want to avoid things that cause you increased abdominal pressure. So that could be tight clothing, but also could be getting your BMI within normal range. It's important not to lie flat immediately after drinking or eating a lot, because then stuff tends to go up your esophagus, or sleep with the head of your bed elevated if possible. So there's a few different things you can do, and really avoid food that cause you personally triggers. You know, those are the ones that are going to get you. Try and stay away from them.
That's great. Those are great tips. Is this condition hereditary, or like can it be genetic?
Not typically. That's not typically what we look at.
That's good to know. And how can people tell when it's time to seek attention from a doctor and not just let it slide?
We usually recommend, if you're having it 2 times or less per week, that's infrequent enough you could consider treating it on your own. But if your symptoms are unusual, if they're severe, if they're persistent, if they're more than the 2 times a week, you really should get that checked out.
Oh, wow. Well, that's a great telltale sign. Is there anything else that you would like to add that I didn't ask you?
No, but thanks for having me.
Perfect. Well, thank you so much for being here today. And thank you all for tuning in. If you'd like to listen to more Health Matters conversations, visit www.enloe.org/podcast. If you have a topic you would like us to explore, let us know. Email us at healthmatters@enloe.org. See you next time on Health Matters.